Hi, Dr. Gaddis. The county that I chose for the Minority Health and Health Disparity presentation is Colquitt County, which is located in southwest Georgia. The reason that I chose this county is because my mom's family is rooted in Moultrie, Georgia, which is a city within Colquitt County. Although I wasn't born in Moultrie, I have many fond memories here and strongly consider this area to be my hometown. Before this project, I never conducted research on the statistics of Colquitt County, so I was very interested in learning about such a small town that I do hold dear to my heart. From the research, I can't say that I was surprised at most of the findings about health and access to health care. However, I was a little embarrassed to admit that I never considered farming occupational hazards as a disparity within this community. Key statistics that I found were that there are 37% of children under the age of 18 living in poverty and 45% of children who live in single-parent households. Also, there are 28% of the population under the age of 65 that are currently uninsured. According to the County Health Rankings of 2015, individuals who are uninsured do have less chances to access health care compared to individuals who are insured. The gathered statistics that I just quoted help to support the claim that a disparity does exist among residents of Colquitt County. According to Nicholas, an article written by Nicholas in 2014, 61% of migrant farm workers live below the poverty line. They are at an extreme risk of occupational hazards. Some of these hazards include demanding physical labor, contact with poisonous plants, chemicals, extreme weather conditions, which when it rains a lot, their toes and shoes happen to get very wet and they're wet for hours. Pesticide-related illnesses, respiratory illnesses, and compromised reproductive and oral health. Migrant farm workers also experience food insecurity, ironically, which directly impacts their children, who research has found also experiences adverse health outcomes as well. Children of farm workers have been rated as having health that is twice more likely to be fair and poor compared to non-migrant children whose health is rated as being good to excellent. Disparities among these children include intestinal parasites, nutritional deficiencies, dental problems, diarrhea, increased exposure to pesticides, high prevalence of obesity, high blood pressure, anemia, and hearing loss. The most concerning finding in this research was that these workers were paid below the poverty line. Therefore, to decrease such extreme occupational disparities, there are certain measures that should be taken. Applying the socio-ecological model to address the disparity among migrant farm workers is the most efficient way to mitigate these disparities. An article written by Andy Miller in 2012 applies the model through the Farm Worker Family Health Program, and the premise of this program is for students from Emory University to travel to Moultrie to treat farm workers and their children. The program has delivered care to more than 15,000 migrant and seasonal farm workers during the peak growing season, which is May to December. During this time, there are several stations offering services such as feet washing, toenail maintenance, and handing out brand new socks. There's also a station that provides over-the-counter drugs such as Tylenol, ibuprofen, vitamins, and antifungal creams. In applying the socio-ecological model, I believe that on a community level, there should be a policy implemented in Georgia that requires monetary recognition for someone who experiences occupational hazards for the greater good of society. Such recognition will be advertisements in local grocery stores, just simply stating the extremes it took to get access to fresh products and also what can be done to contribute to make a difference. The stores will be required to support the collection of donations in hopes to increase the wages of the farm workers. Their work helps to feed us, so we should help to feed them and their children. In applying the socio-ecological model, I believe that there should also be adjustments on the policy level. The Colquitt County Public Health Department is located in Moultrie, Georgia, and the programs and services that are offered at this location include many services which do not include migrant health. Rural public health programs in this area should permanently include migrant health as an official program. The program should support awareness, and policymakers of the county, should greatly consider increasing taxes for all those who profit from migrant work. These suggestions are what I would promote to address the adverse effects of foreign work. In conclusion, there is a need for further investigation into the underlying causes of rural farming occupational hazards to aid in the implementation and effective prevention treatment strategies. By increasing awareness among the beneficiaries of the work done by migrant and seasonal farm workers, there is hope to encourage development of a stronger public health infrastructure and to improve the health status of those individuals. Thank you.